So I would like to share with you about developmental play therapy, and some of the key points are it's based on touch. So it's a therapeutic approach based on touch, and it's also based on pleasure. And those two key factors help to develop a secure attachment with children. And the training is about teaching therapists how to develop an attachment-based relationship with the children that they're working with. And what we call it is a secondary attachment, because that's what we will be reaching for and going for, because there's primary attachments and secondary attachment, tertiary. So a therapist's role is to develop a secondary attachment. So how do we do that? So we have a developmental play therapy program that's broken up into different parts, and the training goes over all of those different ones. So the different sections of the developmental play therapy training include developmental play therapy groups. So you will learn how to do groups with parents and children partnering up, and you learn how to be the facilitator and how to run groups and the structure of what that group is. And then you also learn how to work with children on an individual level using developmental play therapy. And then another way that you learn is to become a facilitator between, say, a parent, a child, and then you are helping to bridge the developmental play therapy games to the parent and then with the child. So you might model those games with the child, and then you kind of bridge that to the parent and support that. So those are the different components of the training. And so the training focuses a lot on the development of the therapist, who it becomes the caring, loving toucher through what we call loving kindness. And then the therapist then first learns how to maybe be a self-toucher and to learn what that touch feels like for self. And then they learn to practice touching exercises with each other and connecting exercises with each other. And then they learn how to practice, and we actually go through a whole developmental play therapy group together from start to finish. The training program incorporates a lot of different type of experiential activities in order to reach that goal of the training of the therapist. So we use art therapy, and we might work with clay, and then we might work with journaling, and then of course a lot of group dyadic processing and group processing, as well as individual processing. So it's a great honor for me to be able to come to England and be able to work with PTI and PTUK in order to share the developmental play therapy program and training program with some of the practitioners that work here.